is alcohol policy part 2. Implementation essentials for prevention practitioners. Today's presenter is Maureen Buslaki. She's the director of the Wisconsin Alcohol Policy Project. She's working today on behalf of the Southwest Prevention Technology Transfer Center. We're located here in Norman, Oklahoma, at the University of Oklahoma within the Department of Southwest Prevention Center. We've been tasked, the Southwest PTTC, with providing training and technical assistance, or instead of saying technical assistance, I typically like to say problem solving, to the states of Oklahoma, Texas, New Mexico, Arkansas, and Louisiana. But we are a part of a larger system, the PTTC system. And so we welcome folks from all across the country. Yesterday, there was somebody from Canada even. So we welcome you, no matter where you're from, to participate in today's webinar. And we're excited that you have chosen to spend your time today with us. And so I will turn the time over to Maureen Buslaki, who's an expert in this work. She's worked in the field of tobacco in terms of tobacco policy. Now she's working in alcohol policy, and you all will get to hear from Maureen Buslaki. She'll also talk to you a bit about the poll question that you responded to. What keeps you from pursuing alcohol policy? Maureen.
Great, thank you so much for having me today. Maybe we could share the poll results before we get into the agenda. So it looks like there's a real mix of challenges that keep you from pursuing the policy strategies. So timing to plan and implement, of course, is always a big one. Readiness is really critical in order to be effective in working on strategies, of course. Skills, there's actually, you already have a lot more skills than you think you do, but we'll talk about that too. Community buy-in can certainly be challenging. Sometimes the community wants to do the things that make them feel good, but maybe don't really rise up on the evidence or effectiveness scale. And then some other reasons, and then some of you are pursuing. So again, thank you for sharing that. So our agenda today, looking at effective policy strategies, outlining those strategies for effective implementation and troubleshooting when things don't go as planned. Certainly that never happens, right? So our objectives are looking at the 3 steps in the planning process, ingredients for successful implementation, and 2 potential unintended consequences of policy. But first, we'd like to hear from you. So if you could go ahead and put your name and organization in the chat. I'd like to know who's all here in the audience. So please go ahead and put your name and organization in the chat.
Maureen, I'm seeing Kristen Staton from San Antonio, Derek Newby, welcome Derek. Melissa, welcome from Kansas, and Jerry from Finger Lakes Prevention Center, Shelly and Chad Childs, we saw you yesterday, Chad, welcome back. Cassandra, Chastity, Holly, Alex, welcome. Fariha, Dulce, Aaron, another Oklahoma person, Carol, welcome Carol, Holly, Callie, Lyanna Munez from New York. So we're seeing folks from North Carolina, or North Dakota, New York, Oklahoma, San Antonio, Florida. There are Tennessee, people from all over the country, Kansas. I love it. What a wonderful brain trust that's being created. Christelle, back from Hawaii. So welcome back. And Cecilia, welcome back. Folks from Kentucky, and Wendy from here in Norman, Oklahoma, at Southwest Prevention Center. Welcome, Wendy. So we've got a nice cross-section of people here today, Maureen.
That's great. So if you haven't already, please go ahead and put your name and organization in the chat. We'll go ahead and get started. And I just wanted to say thank you for doing that, as well as the poll. It's really helpful, like I said before, to understand where you're coming from and the roles that you've played. So now we want to talk about planning steps for success. So yesterday we went over some of the alcohol basics. We identified some ways to get started. We also discussed, at a high level, lobbying versus advocacy. And hopefully people took from that conversation how much you can do and should do with elected leaders and decision makers that's really not lobbying. So now we're going to dig a little bit deeper. So the planning process, and this is something that came up in terms of time, right? Having the time to do this. So, identifying the problem in the community. We talked a little bit about this already, but I'll talk from a different angle. Building leadership buy-in, knowing where you're going to make the change, which sounds simple, but is sometimes a bit more nuanced, and determine who your decision makers are. So identifying the problem. So again, yesterday you talked about a goal, right? Like these are the things we want to change. And it's in part, right, because you have identified that there's something not right. And sometimes I get a little simplistic, but I think it can be effective. If you don't have a problem for people, they don't necessarily want to buy into your solution. Right. So if they don't understand what's happening or the implications of that, I think it's important to think that through. And then part of this is really, and we talked again about this yesterday, consider who's most impacted and make sure you're engaging them in a way that is comfortable for them as well. So, for example, alcohol density maybe isn't a problem in a non-red line part of your community. So it's important that a community comes together and understands the impact of having high alcohol density in a lot of neighborhoods in the community, but maybe not the ones they're living in. So you want to make sure you're kind of bridging that gap and being able to connect, all types of people in your coalition together. And the folks who are impacted or have loved ones who've been impacted, figuring out the best way to engage. And maybe I think there's probably a lot of people in the room have a lot of experience with this. So feel free to chat some of your ideas about how you've engaged members of the community, those who are impacted with lived experience, those who've lost loved ones. How have you worked with folks in doing that? And so as you build all of those different elements, as you're getting started, you want to think about deploying, what else do you need to know? What else do you need to understand in order to engage all kinds of different audience members? So in my experience, there's a swath of decision makers and legislators that really want to understand the math. They're like, well, how big of a problem really is this? And so that's where you have to kind of pull out the economics side of things. So I think of, in communities that have had fatal, we call them OWI, you might call them DWI costs. The latest national data I've seen that is 1.75 million every time there's a fatality on our roadside. With, and these are with alcohol involved. So that, kind of people are like, whoa, I live in a small city or in a town, and that definitely has a huge impact on the community. Now, granted, a lot of those costs are related to insurance and, a damage, potentially medical issues, obviously the loss of life, but there's also direct costs to, your law enforcement system, your justice system, and all of those, your healthcare system that are involved. Whoops, sorry about that. I hit a button. There. Am I back? If someone can give me a thumbs up.
You're back.
Okay, good.
You're back. You're at the very beginning.
Yep, got it. Sorry, I didn't mean to make you all dizzy. Okay. So I won't press any more buttons that I'm not supposed to the rest of the session. So why I say this deploys, really think about the tools to understand the problem from all these different angles. And this is how you bring other people in. The data that we have in Wisconsin, and I think that the CDC has shown in terms of excessive alcohol use costs, really shows the huge problem that employers have. They lose productivity, folks aren't working as well. So there's a lot of issues for employers. And so that can be a really powerful, group or business leader or leaders to bring on board. But if we don't understand the issue from those different perspectives, we're not going to have all of those tools available to us, and we won't have all of those talking points. And I appreciate the comment about, community events, and certainly struggling with alcoholism, and it is different for different people. And I think that's a really important point, that this isn't uniform, how this impacts families, how this impacts an individual. So talking about the problem, and again, this is a little bit a slightly different frame. When you start talking about a problem, I find that people try to pull you in lots of different directions. So I talk about alcohol policy, and people want to talk about treatment strategies. Now, of course, we fully support getting a better system and making sure that there's funding for treatment strategies. But in our organization, our primary concern is primary prevention. So what can we do to prevent the problem? And making sure that we're connecting with those all the way through that kind of process. But being clear about what you want to focus on is really critical. And then don't get sidetracked. And I do think it's important to, as people are asking about other things, to see whether there is an appropriate role that they could play on this particular piece that you're working on. And we do want to do a comprehensive approach on things, but sometimes in our communities, we can kind of only take one thing at a time. I know Alaska recently passed very comprehensive state legislation covering many different areas of excessive alcohol use. And that was a multi-year campaign to do so. Sometimes we're not all ready for that in terms of readiness. So sometimes it's better to take something that you feel you can get your hands around. And so that can be important, and being consistent and being clear about what you're working on. So we've worked with folks doing the drug-free communities grants, and they're working on underage drinking. And their challenge was that they had a lot of data about what the youth were doing, and they're seeing those numbers rise, especially seniors in sports, and and that they're getting the alcohol from places that you wouldn't expect, like retailers. So they had been trying to involve the police, but they had not really engaged much. In fact, they said, well, call us when you're going to do something good with this money. And so they said, well, here, let's try something. Let's do those alcohol age compliance checks. And they're like, come on, all our retailers, they're really good people. And I'm like, yeah, they may be, but let's go check. That first round, they had a 75% sell rate. Suddenly the police department's like, whoa, we do have a problem. And gee, what can we do to work and solve this? So it wasn't immediate, right? But it took a little bit of time, but they have really built partnerships with the police department. And the other important thing about that is that as you're working with people and organizations, make sure you have multiple contacts and organizations. I know that's kind of like a little, sometimes you just work with the school resource officer, or in schools, you work with a particular person. Make sure you're spreading that out a little bit, because people change. They change jobs, they change positions within an organization. So I think it's really important to do that. So framing the problem and giving people something that they can do to solve, it can be really helpful in, kind of in that beginning, those beginning steps. So leadership. So this, I'm actually not talking about decision makers. In this case, I'm talking about organizational leaders, like the head of your organization, or we're talking about community leaders, heads of nonprofits, your public health officer, CEO of a hospital, those kind of folks. In part of this, you're really trying to, build a powerful coalition. And you're building power in the community so that you can be making the case with a lot of credible folks in your community. And so I think that's an important piece. It's also important that if you have tribes in your community, that you're engaging tribal leaders, as well as other populations. So we'll talk about that a little bit more, but you don't want to forget to do that and suddenly be in a position where you want to engage them, but they feel like, that ship sailed and I wasn't on board. So how do you do that? You should make sure that the leaders you want to have engaged know who you are. There's a number of different ways of doing that. Grab a quick 5 or 10 minutes, have a quick coffee break with them, invite them to a meeting that would be particularly relevant to the work that they're doing. And then part of it is listening. What is it that they need from you? So I think about school districts that are having performance issues with students and a disparity gap. And then also, do you have a large swath of the community living in an area that has a lot of alcohol outlet density? So maybe there's some options to think about the impact of that on the community. And maybe you can start kind of tying these things together, right? So that they see where that Venn diagram comes together between the work you're doing and the work that they do. Of course, data, in some ways we have a lot of data. In some ways, it can be difficult to get the right data. But this is where having those youth, the YRBS or YBS in our state, can be really helpful. Like, here's what's happening with youth. We've seen data shoot up in terms of parents just giving alcohol to their kids. And that never happened really before. So that can be important. Also, when you look at impact, what other places have done and been able to really turn that data around. I think that can be positive. There's lots of positive stories out there about the work that has been done and what that has done for the population. So you want to make your case and your return on investment based on mutual interest. So again, having those different players, those different perspectives can help you build that picture and give you an opportunity to build that leadership buy-in. I think one of the hardest things, though, is to just pick up the phone and call people. Email is fine. Certainly you can do that, but that's really the big first step is to make sure either you or people in your coalition are connecting with the players that you want to have at the table. And then building from the ground up. Again, we've talked about this, and I want to give you a couple of stories that I think really demonstrate this point. So we had 2 communities on the same night hold a referendum on going smoke-free. So 100% smoke-free in workplaces, bars, and restaurants. So one was Stevens Point, a very Catholic community with a university. And so we called it kind of the town and gowned, right? So there's the folks who live, work, play, learn in the community, and then there's the university. And they don't always mix together. And so they were running their campaign. It was mostly folks from the university and students involved in this. They were not able to pull in a lot of folks, just from the town, for example. And so about 3 days before the vote was coming up, a priest stepped forward and said, if this ordinance passes, we won't be able to burn incense in our church. Well, that's kind of a big problem in a very Catholic community. And so that turned that campaign. They lost that night. Meanwhile, a couple 100 miles over, Marshfield was running the same kind of referendum, all workplaces, bars and restaurants. But they had, and in Marshfield, I should explain, they have a huge health center. It may be nationally known, in fact, and they do a lot of great research and work there. It really drives a lot of the economy in that part of the state. But there's also a lot of people who live in the town who are not associated with Marshfield Clinic, and there's some resentment at times, right, to the clinic. So this coalition built kind of arms of the campaign. So they really engaged healthcare because that's important, but they also engaged a lot of folks kind of just who live and work there and some blue collar workers. And there was a young boy, he was about 9 years old, who was never able to go bowling with his family, which was a huge family tradition. The grandfather was in like the Bowling Hall of Fame, right? Because he had a lung condition and he could not go anywhere where there was secondhand smoke. And his family stepped forward and said, we want to tell our story. And so that campaign ran with really having connections throughout the community and really talking about people who are very vulnerable to this through really no fault of their own. And they passed by a huge margin. So to me, that's just a reason to really think about making sure you're pulling people in. Sometimes the communities you're working with have both urban and rural perspectives. So I think that's important. And then I talk about grass tops. So those are the folks who have a lot of influence in the community. They may not be elected officials, but they kind of have they know what's going on. And I would say that priest that really wrecked that Stevens Point campaign probably was a grass top, right? He was well connected. He knew a lot of people in the community and had a lot of influence. So now I want to talk about where we make policy change. So I'd like you to raise your hand if you've worked on local, state, or federal policy. So folks can, do the little emoji hand, or if you wanted to come off camera, that would be great. Just to get a sense of how many of you have mixed it up at this level. I'm seeing a number of hands going up. All right. Yeah, well, that's great. Love to see that. So I asked that question because it's sometimes not as clear as we think it is as to what level of government. I've also been in conversations with local folks who say it's the state, or the state says that it's local, or it's federal, and so they're all kind of like, not us. So just remember, there may be other agendas there. And so I'm going to give you a couple of examples of this. And it's important to understand who has the power to do the things that you want to see happen. So for example, we had run all of those smoke-free, campaigns, and, we knew a lot of folks around the state, a lot of public health, human services, and that kind of thing. And then we started to dabble in nutrition and physical activity. And the folks working in that field said, we really want to change the food on the lunch plate, right? We want healthier food options, and we know there are ways to do this. So let's try to figure out what we can do. So we we're a little full of ourselves at this point. We just passed a huge state law and we're like, oh yeah, we can figure that out. So we're going to go to the school board and we're going to get them to change that. Well, school boards don't really get into the level of procuring food, right? They set some policies, but that's not really where the power's at. And so we said, well, it must be the wellness committee, right? So wellness committee for the district, maybe it's at the, the school level. And we started to really explore that. And at least in our state, the wellness committees pretty much had no power at all. It was kind of sad, but they did not, they had no impact on policy. Lo and behold, who held the power? The food service directors. Again, and this is in our state. So we were completely wrong as to where the power was. And so it was really important to figure that out. And then, instead of demonizing the food service folks, because, they had Pop-Tarts on the menu, it was much better to be positive and really understand the challenges they face in terms of procuring healthy food at a price that they can afford, right? So, I think it's important especially as you're entering the fray on some of this, to be as positive as possible, so you're not alienating potential folks that could help you later on. So I think that's important. Again, understanding, really where does the power lie on the particular issue you're working on. In our state, alcohol licensees are mostly at the local level. There's permits at the state level, which is kind of the microbreweries, having people come in and drink there versus, the bars and restaurants and liquor stores and all of that at the local level. So, even in our work, there's this divide between what the locals can do and what the state does. So, know where you got to start. And then sectors are important here as well. So you're trying to build some power in your community. You're trying to build a powerful coalition. And as I've talked about, having multiple sectors involved is really helpful. And so there might be some sectors that could be really great partners. And it's always important to think about where they are and then also set your expectations appropriately. So like we work with a lot of violence prevention folks. But for example, in the city of Milwaukee, there's so much going on. It's been a terrible last couple of years for our violence prevention folks and our violence interrupters. And so it's hard to pull their attention to say, hey, we got to think about some alcohol related issues, because the evidence is starting to show all those, binge drinks in a can, and even outside of liquor stores and convenience stores, there's a lot of violence, that we could potentially, if we join forces, address together. So it's kind of understanding whether or not they are engaged with alcohol related issues, if they're ready to engage in that, and if they have the capacity, right, to do so. Of course, funding is a real issue. And I think it's always wise, whenever you are able to, sometimes the resources are so small, spreading them thin just makes them, almost unusable. But if you're, making sure that there's resources available for those who are really participating with you is important. Also, your existing relationships and partnerships, as every now and then, it's really good to just re-examine that and see, where they are at. Because sometimes those partnerships, like you've got a really strong relationship with a community-based organization, but they're holding events at breweries to raise money, for domestic violence or violence prevention. We recently had a great organization have an open bar at the beginning of their gala. What? So can you work with them to sort of change that internal policy? Because that might help them then be able to go into this work with you feeling a little bit better. There's also cultural norms when you think about where policy occurs. We certainly have experience with, we have alcohol licensing boards on the local level, and some of them just tend to grandfather in licensees. So when they sell it to their cousin or their son or daughter or whoever, they don't do it as a new license, which is in our state incompatible with state law. So there's this cultural norm. And so, it may be that you just need to be able to shine some light about the possible issues that way, and that you could kind of work that policy without getting too much into lobbying, right? And just making sure that the members understand what the state law is, that the clerk understands what the state law. So sometimes that policy can occur there. And then working with those who have past experience can be really helpful. I also just want to say a couple more things about policy. I think everybody probably has experienced an advisory referendum. And the difference between an advisory and a binding is whether or not it's law after the vote. And so I would caution against that. I'll give you an example. Here in my county, they're going to go to the ballot for the third time to talk about legalizing marijuana. So this goes back to levels of government. The county cannot make that decision. It's a state decision. The county I live in is not where the power of our legislature is. It's a blue county. We've got a red legislature. So they don't really care what our county does. And that's so much time and energy that could be spent on different things. Of course, talking about that particular policy is a whole nother can of worms, but I think it's important to think about where to put your energy. Also, resolutions can be, doing a resolution in a local body can be just as hard as actually running the campaign. And so just consider those things, as you're thinking about where policy could occur. All right, we're just about to the poll question. So one last point, and then we're going to ask you some questions. Who are decision makers? So get familiar with them. When I was doing a lot of lobbying at the state legislature, I subscribed to a lot of newsletters. It was amazing what you could learn just from what they write, the things that they care about. I found people to be champions in things I never thought that they would be. So people are not uniform, and alcohol policy has so many different aspects. You may find allies where you didn't think you would. So, follow them on social, keep track of what's going on in the news, and introduce yourself. So talking to an elected official doesn't mean you're lobbying, right? Again, like we talked yesterday, make sure you run all of the steps through your organization and the rules and that kind of thing. But, really understand that there's a lot of opportunity to talk to your funder in a good way. All right, so now we're going to do a poll. Want to start talking about which steps are you confident in and which do you find challenging. So I think the first poll will go up.
So we must have folks who are thinking about it, Maureen. Which steps are you confident implementing? Identify the problem in the community, build leadership buy-in, identified policy solutions, determining where to make change, determined decision makers, or none of the above? So please join the poll right now. We've got a few people who are responding. Okay, seeing some more responses come in. Which steps are you confident implementing? You know, Maureen, I think this is a good question for you. So which step are you the most confident in when you're implementing? Like, I know that you've been a lobbyist. I know that you've done work in tobacco, but like, which part do you feel like I'm usually pretty good there?
I would say, determining where to make the change. I love kind of pulling that to make sure we know exactly who decides. And it can be complicated, but I love figuring that piece out. And then making sure you're really working with the people who decide. There's a lot to be said about working with the folks around those decision makers, but really knowing, who the ultimate end decision maker is so important.
There are a few people we're still waiting on. Which step are you confident implementing? We heard from Maureen. She said, really determining, where to make the change. So identifying the problem, building leadership buy-in. I mean, we're preventionists, so many of these things we're just good at. You just got to be good at. Yeah. We have Derek Newby. He said, my favorite is identifying the decision makers. Excellent, Derek. Thank you for sharing.
And it looks like poll 2 is up too.
So poll 2.
Yes, they can answer both questions.
Okay.
Great.
I'm only seeing one on my Zoom, but that's okay. So which steps do you find challenging? Which step do you find the most challenging? So please complete that poll as well. Again, I'm going to go back to you.
Sure. Challenging. I think sometimes getting leadership buy-in takes some time. And so it can be, if you're not familiar. So for example, in my past, I didn't work a lot with law enforcement. And so I've spent really the last year deepening those ties and building understanding with law enforcement and kind of their culture and how they think about things. And I've learned things that are important to them, but they're not necessarily that Venn diagram again. They're not into everything that we're doing, but they're into certain things. And they are willing to be great champions and supporters, like place of last drink or alcohol age compliance checks, but they're not so interested in, some of the other issues. So.
All right. So we have both of those. Thanks, Wanda, for letting us just scroll down for the second poll. The questions that we're answering: which steps are you most confident in implementing? And which one do you find a little more challenging? Derek Newby in the chat box, he says, the challenging part for me is building buy-in because people tend to see the world from their own perspective. Which is true, right? And I think our job there is to really shape the conversation so that we certainly are touching on the things that are most important to them and that they can see their perspective. Robbie, it looks like Robbie Mullins, long-term time preventionist, certainly somebody that I look up to as a preventionist. She said, take time to build those relationships. Like building those relationships are important. And that's the piece. I mean, if anything, we as preventionists, we're relational. We're collaborators, we're relational.
So it looks like we have a good number of answers in.
Yeah.
So maybe we can share the results with everyone.
They should be seeing the results.
Oh, okay, good. Sorry, I have a different view. So yeah, so I think like you were saying, LaShonda, the first part is identifying the problem in the community. That's what y'all do, right? On a regular basis. And then it looks like kind of mixed in between, what your confidence is, but determining decision makers, came out on top on that. I think that's great. In terms of challenges, it's, that leadership buy-in, identifying those policy solutions, and where to make the change. So, and those are, that's why we asked, right? Those are all common issues. So great. Well, thank you all for taking that poll. It's helpful. Any other thoughts or comments folks wanted to make about that? If so, feel free to go ahead and say something in the chat.
Derek responded again. He said the challenging part for me is the buy-in, but then he also said, Robbie, you are correct. It's so hard when people move on and you're invested in building the relationship. Goodness gracious. Now I'll tell you that that's one of those things, especially during COVID, that has burdened us all, right? Like people are moving on, doing something different. We know that in prevention, that it really is a predominantly women-led career path. And so COVID sent so many women back out of the workforce. And so we saw leaders change. We saw our staff, our prevention team members change. And so, what's your response to that, Maureen? Like, how do you manage that, the sort of transience we're sometimes seeing?
Yeah, and it's not new, actually. When I was at the endowment, I oversaw 45 projects that were doing policy and systems change, and there wasn't a single one that didn't have key people change jobs or turnover or whatnot. So that, but I think COVID, like it went, boom, it really changed. I consider it an opportunity, to bring in some fresh ideas, one of the things I love about talking to people who are new to the field is they bring different questions and perspectives that I may not have thought of. So I think it makes us all better when we take the time to get to know and kind of develop those relationships. I know, again, it takes time, but I think it's important. And I'm finding some of those that are trained more recently than I was really are ready, more ready to dive into policy. And so that's exciting to me versus, I think we've all seen a lot of interventions, and then you just have to keep doing those interventions over and over again because you haven't changed the system or the policy around it in order to have it hold. Like you're constantly trying to get money to do this one thing instead of, really changing the system around it. So again, that's a whole nother talk, but I think there's some advantages of bringing new folks in too.
Also in the chat box, Jerry, he was here yesterday and he talked in the chat box, he placed information about 1,000 cups of coffee or 10,000 cups of coffee. There was a number that he shared, but his point is that we need to spend time. We need to drink lots of coffee. And he shared it is hard to build those relationships electronically and virtually. And then you toss in can you handshake or can you not handshake? That's its whole other issue. What's your perspective on that?
For sure. But I feel like it is time well spent, getting to know folks and determining, why they're there. Sometimes people are at your coalition table because that's just what their organization told them to do. And that's just part of our reality, right? But what I love is when there's a little spark, and somebody really wants to, hold on, be that pit bull on a particular part of the campaign. And so, really getting that information and that energy can be so great for your coalition. And coalitions, I think we have to plan that they're going to turn over, and so when we do that, then I think we do a better job. One of the talking points that I have in my notes is to make sure you're talking with new decision makers and trying to keep them in the fold about what's going on, right? And the reason for that is they may only get part of the conversation from their colleagues, and they may not know the history of how things have developed. Same thing with new coalition members. So it's a really great opportunity to harness some new energy and perspective and build back better, right? So I don't remember if that's a good saying or not, but I think it's good.
Yes. And then there's just folks in the chat box who are saying, love that energy. We've got to have a glass half full type of energy is what Derek's saying. And Robbie's saying, absolutely, Maureen, it can be very refreshing to have new people with a desire to make change. And that's tough, right? We have those folks who are like Robbie, I like to say, our veteran dolls. But then we have those new folks who come into the field and they ask questions and they challenge and they knock down these sacred cows that we have left and right. And that's frustrating and exciting all at the same time. So I like this idea of like really using our new and fresh blood, you know, while we also honor and respect our veteran preventionists.
Absolutely. All right. So things to consider when passing policy. So I'm talking about, you know, the very time when like they're going to sign the law, the community organization is going to change their you know, policy around serving alcohol at events, or, you know, whatever level it is, whether it's the food service director all the way, you know, to the legislature and the governor. And so just a few things that I wanted, and there's a lot more to talk about here. I'm sure Robbie knows that, right? When you're passing policy, but there can be last minute changes to the proposal. I would say make sure you read those carefully. Take a breath. There's a lot of pressure, I know, but take a breath and make sure you understand what they're trying to change. It could be damaging. Last minute vote changes. So I can't tell you how many times I've seen that happen. In fact, we had the speaker of our assembly tell the executive director of the American Cancer Society that he was voting with us on a bill. And then he went back to his podium and called for the vote and voted against us. Now the measure passed, and that's why he claims that he voted against, because he could, but he waited to vote till the end, supposedly. So those vote changes can be challenging. The way I protect against that is I have 3 different people from 3 different perspectives kind of checking in. So I always, you know, they may say certain things to certain people. And so it's important to really get different people asking the question. We've had, you know, ordinances up and somebody who's your champion like literally dies before the vote. And so then the whole thing crumbles. And it's horrible for them and their family, obviously, right? So there's a lot of grief and there's frustration too. So those things can happen. I guess I'm saying all of this to know that you're kind of not on solid ground all the time. You don't, we don't know what's going to happen, right? And so I don't want you to feel paranoid by that. I just want you to know what some of the possibilities are kind of at the last minute. When you're passing policy, compromise is not all bad if you obtain your goal. So the example I use is on taxes. So we know if we raise taxes at a certain level, we're going to reduce youth consumption, whether that's tobacco or alcohol. And so there's some room there to as long as you get above a certain number, you're going to have that public health impact. But what I wouldn't compromise on are things that are important that they apply to everyone. So again, to that smoke-free law, if you're exempting groups or workplaces, you're leaving people behind in a very bad way. I would walk away from that legislation. So it's important with your coalition that you figure out what are your points, like worst case scenario, and we'll still be in the game, worst case scenario, and we're out, and we're all walking. And I think those are really important conversations to have, not in the heat of the moment, but to have as you get going. And then one of the famous tricks I think that the alcohol industry plays is gutting enforcement on a bill. So they'll give you something that you want, and then they'll, reduce the number of people who are in charge of enforcing that law. So you need to really think about what the challenges are and if they're going to pass the law anyway. One of the pieces to consider is we've found in tobacco control around preemption, which is probably an issue in some of the states here as well. And preemption is when the state supersedes local laws. if they've passed preemption on locals, for example, doing smoke-free air laws, it can be 17 years on average before they get that changed. So again, important to know what you need to walk away from. It may pass, but at least you can walk away and say, no, this is not the way to go. So that's, you know, those are just some tips about as you're thinking about where you're headed. And then sometimes there's, you know, last minute policy fights within the industry. And at some level, I'm like, watch, maybe don't get involved in those if you don't have to, and kind of see what happens with that, because the industry is not one monolithic, same voice, same policy that you might think it is. All right, so now I'm going to talk about implementing that policy. I also just want to point out that a lot of what I'm going to talk about is also things that are helpful when you're organizing your campaign. So kind of the type of issues that you come up against. So for this, we're thinking about, you know, you've got that policy through. The community-based organizations have adopted the rules where they're not, you know, having free-for-all on alcohol at their organizations, or not, you know, having them at exclusively alcohol-related venues. The school is, you know, doing the screening and brief intervention. You've got a new licensing policy, you know, those kinds of things. So what I'm going to talk about is these 4 pieces: staying organized, making sure people know what role they're playing, continuing to influence the environment that decision makers live in, and making sure that you understand communities' use of media. So for organizing, you know, there's many different ways to do this. Some people use a method before they go into the campaign and then use a different one when they are implementing. You know, that certainly can work. One of the tools that I've found that has worked for us for both pre and post is the Midwest Academy strategy chart. So there's a whole 5-day training session on that particular tool, but it can be very helpful in terms of centering and focusing folks. So, you know, making sure you've got the goal of what you want this campaign either to look like, or what you want that policy and how you want that policy implemented. So sometimes you pass that great policy and there's rules that need to be made based on that. That can get totally messed up, and then you don't get what you need out of your policy. So it's, you know, that's one of the hard things. You put all this energy to get it passed, and now you have to make sure it happens, right? And people do get burned out. So going back to bringing in new people and new excitement, this can also be a great time, you know, to actually actively recruit people, you know, to help bring that energy into the coalition again. So some who try to disrupt that process in terms of rulemaking and the implementation, you know, are the opposition. In some cases, you know, the policy campaign in some ways just hasn't ended. And so you have to really kind of keep that mindset. And then going through some of the models just up on this particular chart, like, you know, who is able to do what at this point, right? Organizational considerations. So after something's passed, sometimes governmental agencies are in charge of making sure this all happens. So the roles may change. So it's also a good time to think about who's doing what, you know, and then you think about who's with you, who's against you. Sometimes people that didn't want something to happen, you know, slowly come around on it. I can't even count how many times we've had opposition come to us, you know, a year after a policy has passed and said, this was great, you know, like this was the right thing to do. So your opponents may change over time. You know, thinking about, again, those decision makers in terms of who is in charge of implementing the policies. Again, that can change over time, something to keep an eye on. And that quote they say about keeping your friends close and your enemies closer, maybe an organization or some people that you don't feel like care about the rules that you've just passed as much, you might need to just continue to be persistent and helpful to those folks. And then, of course, the part on tactics comes along. And as you're implementing, I think we find there's sometimes backlash, right? Remember when we got healthier lunches, and then there were stories that came out that the football players weren't getting enough calories. So there's always this backlash. And so you don't want to dissolve the folks who helped get you where you are, because you're going to have to deal with that, right? And so you may have to have, again, different voices, saying, no, this is how we need to do this, and here's how we overcome that particular issue. So roles that you can play, and again, this is kind of both pre and post, but I would love for folks to put in the chat, what role have you played? Now we had some different roles up in the beginning, but just wanted to get a sense on some of these roles. You kind of still need somebody organizing and keeping things together. You need your connectors. Of course, we need experts, to deal with some of the negative backlash, and I'm sorry to use all these tobacco examples, but when we passed the smoke-free air law in one county, like 10 businesses claimed they went out because of the law. Well, the public health department actually looked into the data and found that, most of them were, holding on by their fingernails financially. They weren't paying their taxes. There were all kinds of problems. The owners were convicted of a crime, so it was like every reason under the sun except the smoke-free air law. Now that might have pushed it over the edge for them, but they were on the path of going out of business anyway. So being able to have some of those conversations can be helpful, but those experts may be different at different stages of the campaign. Again, keeping work in the community going is important. It is important to watch the opposition, both pre and post. In my experience, people can get obsessed with what the opposition is doing, and I don't find that helpful. You need to know what they're doing, but if you have a good plan and you're moving ahead, I wouldn't spend too much energy on that. You need to keep an eye on it, but don't become obsessed about it, because then you're not going to run your campaign or your implementation as you should. Instead, you're really playing into their hands. And then, of course, communicators are really important. Yes, obsession leads to paralysis. Absolutely. And I think that's why sometimes things don't get off the ground. We don't start moving ahead. We're so worried about what might happen next. So thanks for that comment, Jerry. So decision makers environments. So this is where, like, you got to pay attention to what's going on around you. What are the hot button issues in your community? And again, understand what they are. I wouldn't dive deep or make assumptions about what that means for people's time and attention and energy. But you do want to think about that and understand what's happening. What are people talking about? If it's increased violence, maybe, there's a connection to the work you're doing. In my city, we have a lot of violence downtown. And so if anything happens after 10 o'clock at night on my side of the town, there's almost no police coverage at all, because everyone gets pulled downtown because it's such a big mess and we have a lot of alcohol outlets down there. And so maybe there's a way of connecting that concern about what's happening downtown to also other concerns that relate to the alcohol policy work, right? So kind of continuing to provide that different perspective in your community can help influence like that environment that decision makers are living in. Getting to the point where your issue is being discussed, and because we knew we were going to win some of our campaigns over time when people were talking about this just randomly in coffee shops or the grocery store, while they're waiting in line or whatnot. And that's where you've really reached a level in the community where the issue that you're working on is so important that it's really permeated, right? And folks are talking about it. So I think how you do that is really that drumbeat. I recently had a colleague say to me, "Do you get sick of saying the same thing all the time?" And I'm like, no, because that's how we get through, right? Every other campaign is telling you the same thing, whether they're trying to sell something or change something. It's that drumbeat, that you really need in order to have it become part of common conversations. And then creating cover for doing the right thing. So an example I have is on taxes. So when you think about like alcohol taxes, a lot of successful campaigns dedicate those dollars to something that people agree on. I've seen it dedicated, towards kids or education, those kinds of things. And that can really provide that cover for, hey, you're making me pay more for something. Oh yeah, but I also care about kids, and I want to make sure that we're funding those programs. We're doing, the different things. It's for treatment. It's, for those kinds of things that can really help. So making sure you're thinking about that, creating the cover for doing the right thing, even when there's opposition to some of the work that you're doing. And then media will play stories in a lot of different ways. And so sometimes you have to counter what you keep reading. So they did a study in New York City when, again, I'm sorry for tobacco, but there's just so many good examples. They passed the smoke-free air law. The stories were 4-1 against it. This is a mess. Bartenders are going crazy. The bouncers are getting into fights, and, there's all kinds of stuff going on, right? So they did a poll and they asked people, how they rated different things. And it turned out that people absolutely loved the smoke-free air law, even more than the New York Yankees, right? So despite what, media was playing up, because they always run a controversy, that's how you sell papers, right? That people really supported it. And so it's those kinds of polls that can help bring things around. And, I know they're expensive, but it's certainly something to consider. You can pay to get questions into particular polls, and that can be helpful too. But sometimes you need to really go to who the decision makers listen to for their polling in order to really make that work. So then we're gonna again get into a little bit of a discussion here in the next couple of slides. Just want to touch base again on communities' use of media. So you may have worked with, the state journal and, the different newspapers, radio stations, TV, but sometimes the opposition and the scare tactics are not in those media channels, right? Certainly we see that with social media. And so you need to think about those audiences and make sure that that you have a strategy in order to do this, right? And so I think that that's a really important piece. So what kind of media does your community use, and what do people respond to? I think, you don't have to react to every single negative comment about, the work that you're doing or the policies that you've passed. But it's really important to think about who are they listening to in your community, especially those who are most impacted? You know, I've had coalition members and myself from time to time on Hispanic radio stations, right? Where they're talking about how this impacts their community, and it's very different perspective, you know, than when I'm talking, you know, to the regular NBC news station or whatever. So, neighborhood e-blast. That's great to know. Thank you, Jerry. Next door sometimes can be saying a lot of things depending on how local your campaigns are. I'm not sure what penny savers are. The final call. Jerry, maybe you could come off mic and tell us what the penny savers are.
Sure, the penny saver carries everything in the local community, sales, who's having a garage sale, who's giving away this, that, and other thing, and also human interest stories. So they tend to be free. They come out on the Thursday for the weekend. You can get your grocery shopping coupons in there too.
And you can get stories in there?
Oh yeah, you gotta be creative about how you do it.
Yep. And Derek, you had the final call?
The final call is a Muslim newspaper. Traditionally, it's sold on corners in urban neighborhoods, especially in larger cities as well. But it has migrated across the country, and whenever I see someone out with the final call, I tend to purchase that as well to give me a perspective from those believers as well.
Yeah, that's great. And Georgiana, it looks like you have the patch.com.
It's just a local regional newspaper. So like specific towns will have their own rather than like say a county or a certain section of a state.
Oh, great. Okay, thanks for sharing that link too, Derek. And coupon books you also had?
Yeah, so some of our coalitions have had success with coupon mailers that get sent out to residents, and they've put messaging in there about, you know, different policy changes that they're hoping to make or different reminders about existing laws.
That's great. That reminds me, we used to do an insert in the weekly newspaper, and we got some of the best coalition members on the local level from that. So it's not always where you think, right? Well, thanks for sharing that. So after a policy is passed, sometimes resources change. And so it's also determining what your capacity is as you're dealing with the implementation. And so sometimes people have moved on, like the interest has moved on next to the next problem, right? And so understanding kind of what kind of time your partners have for this, understanding what funding is or is not available as you go forward, you know, are really kind of important capacity signposts that you should be paying attention to. So we had passed a big law, and then there was a local community that wanted to, you know, have, well, it was, God, what's that smoking thing? Like it's a big pipe. I'm blanking on it right now. Sorry about that. And it was in a place that was exempted from a law, but nobody, hookah, yes, thank you. Got friends, fortunately, on the call here today. And I could not drag people, you know, to get involved in that, and not having that particular place open because they would have been fallen under the cigar bar exemption or whatever. So that's why exemptions are bad, right? And so, you know, it's also kind of recalibrating where people are at. And, you know, I think talking early in the work to make sure that people are going to be there on the other side is really important. It's also sometimes some of the backbone folks, while you're implementing, they're doing a ton of work to make things change, right? And so they might not have time to support some of the efforts that they've done in the past. So it's really an important piece to think about and measure the capacity of the coalition as you go forward, when you're thinking about your time, the funding that you've got, and kind of the interest with everybody and what's going on. All right, so next up, discussion. We wanted to talk about what insights that you've had, or either by watching or experiencing these different policy campaigns. Kind of, what have you seen in terms of how things play out? I think we've all seen lots of different challenges, watching policy campaigns, either at the national level, the state, or the local level.
So you all, please, in the chat box or raise your hand. We'll be looking for hands raised. If it's easier to just speak it out, raise your hands and we'll ask you to speak. Maureen, one of the issues that I've had, or experiences that I've had, is social media. Social media is so good and so bad all at the same time. It provides the most accurate to the moment information, and then just fiction. And so working through that has oftentimes been interesting. Kaleem said, quick viral. Kaleem, hopefully I'm saying your name correctly. Do you mind just taking yourself off of mute and sharing, what do you mean when you say quick viral? I don't hear Kaleem. I'm assuming that they are not able to speak out at this moment. Well, we also have Jerry Bennett. Jerry said marijuana opt-out. One town board member was potential grower / farmer, thus needs to know the audience. Tell us more about that, Jerry. Are you able to come off of mute and share?
I'm here. I had the chance as a local resident to present on the issue here in New York State of whether a town or village can opt out or not of marijuana retail or marijuana consumption bar dispensary in their local municipality. So I did my presentation, and then we found out that one of the people in the audience, in the town board, had farmer grower influences, let's say. Now it's still, his potential opposition didn't pan out, but it was good to know, where your opposition is coming from in this case.
I love that. It's important. Where's the opposition?
For
And
sure.
sometimes the opposition sitting there amongst those decision makers, right?
Absolutely. Having a tavern owner in the legislature or in a local city or county board can really shape things, especially if they're one who gathers leadership power. So yeah, understanding some of those things.
So Marie, one of the things that I've heard in the past was, there's this balance in letting everyone know that there's a policy decision being made, and then being really quiet about it, so that, about the policy decision being made. How do you balance that out with letting everyone know that this is something that's going to happen, or, being quiet and just helping to get that policy move through quickly?
So I'm sure there's exceptions to this, but in my experience, there's almost no quiet. And there's a couple of reasons for that. One is that there's so much work that needs to be there in community buy-in, because once you change something, you want to make sure that people understand and then comply with the law. So that's a piece of it. If you try to pull something over license holders or the Tavern League, in our state, by suddenly slapping on a new restriction. Sometimes they react by going to their state legislator and trying to shut it down altogether. So, there are things, I think, subtle things, like working with the police on alcohol age compliance checks, but making sure, of course, you're letting the community know that they're happening, but that you might have some different methods to make sure that you hit every licensee twice a year in your community. And so it might be done on an ongoing basis instead of just once every 6 months, right? So some of those things, I don't know that they need to be publicized as much. But then there's the others. So I think there's some backlash sometimes if you don't. It's also been my experience where we've had gung-ho city council, we're going to pass this smoke-free air law and we're just going to jam it through. That never worked. And like changing the alcohol licensing process is, I have an attorney on staff who's also a PhD in neuroscience. Anyway, the woman's on fire. And so she deals with all those details of every little piece of that licensing process. And I'll be honest, I love policy, but there's pieces of that bore me to tears, right? And so it's really important that you focus people on the big picture and not getting into the minutia, perhaps. So there's that balance. But generally speaking, it can be a detriment, obviously, to have everyone at the table screaming in terms of getting things done. But I do think what I've seen, and the CDC actually backs this up with some of the studies they've done, people get there before the politicians do. So as preventionists, a lot of the work that you already do is bringing people along, and they've already started to change their mind about how they want things to happen. And then the policymakers come after the fact. So sometimes you've got that public support and you need to make sure that you leverage that. It's important to do all the checks to make sure that's a true statement, of course, but yeah. All right, so let's talk about when it doesn't all work out. So as you're thinking about like that implementation, also knowing how you're monitoring the change that you've just made. Who's accountable for those changes? I'll talk about this a little bit, but I just have to share, they passed a policy where there would be more farm to school work and that there's a position now in the department for that. But the legislature didn't bother to fund the position. So, that's great. But who's accountable? They didn't put any money in there. So you're not going to really make the progress that you want to make on that. Accountability, of what the people, how they're supposed to abide by the law, and what are the steps to make sure that happens, I think is really important. And feedback opportunities for improvements to make sure things are working right. Sometimes the law can be written really tightly where it's hard to make change, but sometimes you have that opportunity to continue to improve. And if, your organization is part of, the change that needs to happen, I think it's important to acknowledge if mistakes were made, right? And take responsibility on that. So even if you're an agency, I know sometimes it's harder to go through the whole leadership to get approval for that, but if you can take responsibility to say, we didn't get this part right, it's one way to kind of reduce the news cycle on that, right? You got social media who's blowing up, right? When you think about when the Affordable Care Act passed, and the computers shut down as people are trying to sign up, right? They didn't plan for that level of capacity. And, it's better to just own that and then move on. So I think those kinds of things are really critical to be thinking about if things aren't working right. Some of the unintended consequences. So again, in the chat, have you experienced any of these pieces? So in mitigation of harm, for example, when we were able to pass higher taxes and the smoke-free air law, that was great, but it didn't mean some people weren't harmed. A lot of folks with mental illness have a very strong addiction to nicotine, and these policies weren't helpful for that population. And so you got to think about who doesn't benefit from this, and how can you deal with that harm. So again, thinking ahead of what do you need to do to see that. Sometimes you can't always anticipate what some of those pieces are, but it's helpful if you can think about that ahead of time. Community backlash. I'm sure folks have seen that, in a number of different issues, something that you're trying to do the right thing, you're trying to make good things happen, and it doesn't work for everybody. And so how do you work with that? I think one of those things is sitting down and finding out exactly what the problems are and try to come up with some solutions. Yeah, a drug hotspot got moved to another neighborhood. Yeah, that's interesting. And yeah, a lot of those unintended consequences. Negative economic backlash. We've seen that. Certainly, Native American owned casino decided on their own to go smoke free. And it was exactly at the same time there was like this change in payouts. And so they lost money their first year. And I don't think it was a small amount. But they stuck with it because the owners saw the impact on health, and they kept with it. And now they're doing great. They have less staff turnover. People stay at the casino longer. I don't know if that's good or bad, right? But for the economic impact for that casino, that's good. And so there can be a lot of those kinds of things. We've also seen, as you make changes in, where alcohol can be sold, like and marketed inside a store, when you think about, changing some of those things like access to single cans, not having it close to the soda, you may have retailers complaining about the negative economic impact. And that's where I think keeping on your messages about the positive part for the community, that you're not, you're trying to make sure that kids aren't getting their hands on stuff or stealing stuff that they, have easy access to. So now sometimes working on an issue. So Derek, and talking about Arkansas, preventing the legalization. Do you want to come off mic and talk about that a little bit?
Sure. We were very animate and outright with our campaign in Arkansas to prevent the legalization of medical marijuana. But in doing so, it seemed to wake up the community on the other side as well. We put up billboards, we had TV campaigns, and although we built a lot of support because we were so public with the fact that we were against it as a prevention community, the other side also got more aggressive in their campaign to legalize it, and it did become legalized, and then they didn't stop. We sort of regrouped after that and decided that it was time to rethink the way we were doing prevention with marijuana, definitely with it being legal for medical. And we wanted to make sure that we were giving accurate messages and providing facts. And they just came out full force and went straight for recreational marijuana, and to the point where it is now on the ballot here in Arkansas and likely to pass as well. So it's alarming at the fact that like we are restricted by rules on how much we can do, and the fact that we have to be very political about lobbying, following the rules that go along with that. But on the other side, they can pretty much do anything. And even they went for our top like people in government, and even the people that were on boards that would be regulating it, and started like recruiting them and paying them to work for them. So we just lost so many advocates in our fight for this, and even to the point where with our regulation board, they had to revamp and get new people on there. So it just set us back in so many different ways.
Yikes. Yeah, that's tough. So other ways of dealing with unintended consequences, those relationships are important, right? And keeping those, like you had said, Derek, too, being a trusted source of information. And sometimes then people have another reaction. So making sure folks understand what the flaws can be of that, those particular reactions to that. And I think it's also important that policy change is a process. The example you just gave, I think, shows, that there is a lot of things in motion, especially nationally, how things are playing out, and the momentum on the cannabis issue is certainly real. So we just have a couple minutes left. If you can, answer a couple questions in the chat. I'm going to just slide into these other slides and turn this back over. But we are interested in, when you've seen things that were supposed to improve that haven't, or, what have you seen or been part of, to reduce harm, in a strategy. It's a quick summary. And then we have references, so you should have these or will shortly, right, LaShonda?
That is correct. You should receive those within the coming week. And then here we are at our feedback survey. So, and you will find that on the screen. You can use your camera to click that QR code on your phone, or you can go to the chat box and click the feedback form in the chat box. So you have options for completing our feedback. Maureen, I certainly appreciate you joining us today and sharing your expertise with the group. You all, this series, this two-part series is replete with lots of information that will be helpful to get you all started. And if you're started, we'll keep you moving. So please, feel free to contact me by email and let me know, what are your follow-up needs around this area, right? Like we want to make sure that you feel like you are tooled up so that you can go out and truly engage in policy work. We've got great experts in the field that I'm sure are willing to provide, a TA to us and TA to you so that we can help you as you strategically plan to address alcohol policy issues in your neck of the woods. I appreciate your time today as well as yesterday, and I hope you all have a great afternoon. Take care, everybody.